So there's similarities between the sinuses and the gut. So the beneficial and pathogenic bacteria in our gut has been getting a lot of attention in the past many years, but I think the forgotten piece, or the not so research piece, is the microbiome in the sinuses. We are seeing some research now. So there are millions of different types of microbes, both beneficial and pathogenic, that normally live in our sinuses, just like the gut. So it's our sinus microbiome. Well, the sinuses were once thought to be sterile. And then there's been more recent development of new technologies like genetic sequencing that shows there's actually a diverse community of many species of microbes that have been found in our sinuses. And like the gut, it includes bacteria, fungi, viruses. And like the gut, the beneficial, pathogenic, and benign microbes live together in complex communities surrounded by biofilm they create. So we can test for the biofilm, the sinuses, and I can't test for viruses, but definitely bacteria and funguses. So it's an area where the research is in its infancy, but it's happening. So we can get dysbiosis in the sinuses as well. Like there could be insults to the gut, like allergens, infections, or antibiotics, or in many people, gluten. There can be insults to the sinuses, air pollution, allergies, infections, COVID. So we can get dysbiosis in our sinuses just like we can in our gut. So I think about it just like the gut. And so treatment is like that as well. So then when I talk about this treatment, it's based on what I think as a naturopathic doctor. It's in no way conventional treatment, but I see it work often. So just like testing the GI microbiome, I'm testing what I can for the sinuses, all the tests that we talked about earlier. We don't have a sophisticated test for the sinus microbiome available yet, but hopefully it'll come. And so then for people who might have heard about the 4 R's of gut repair: remove, replace, reinoculate, repair, and rebalance, something that Dr. Diana and myself learned a lot about and do a lot about. Is that those are just the tenets of naturopathic medicine in the gut, right? So first we remove. In the gut, it will be removing the pathogens and other inflammatory triggers. So same with the sinuses. I'm treating the infections. I could be nebulizing antifungals or even antibiotics if warranted. So depending on the infection and sensitivity. And then replace is next. So in the gut, we replace with anti-inflammatory foods, right? And in the sinuses, I learned this from an ENT doctor, lining the sinuses with organic coconut oil to make the area moist in preparation for the infection kill, and to help decrease inflammation is important. So he told me that if it's dry in there, then it's very hard to kill the infection. So you want to keep it moist, and the coconut oil brings inflammation down. And then the third step is to reinoculate the microbiota with beneficial bacteria. So just like in the gut, so we want to put probiotics in there. So there's a great nasal probiotic that can be used for this. I like Nasal Biotex. And the fourth step, the final step, is repair. So in the gut, we can repair the intestinal lining with many herbs. In the sinuses, I'm using nasal peptides, maybe BPC 157, or that'll bring inflammation down, or CMAX, which will help with brain inflammation. C-Lank will help with anxiety, or RG3 to decrease inflammation and heal the mitochondria in the brain. So I'll use neural peptides to decrease inflammation, anxiety. Once the infections are killed, a lot of times people might want to use the peptides first because I just want to get rid of that brain fog or that bad feeling in my mind. But usually I'm finding those peptides don't work until we deal with the infections first. And then they work amazingly. CMAX and C-Lank, you can spray them in. And then BPC 157, you can get spray form. Before I kill any infections, I want to modulate the immune system, because I know that killing infections and even detoxification is going to cause inflammation. So I'm putting really good band-aids on the immune system first. So they start off as band-aids because I haven't treated the causes yet, right? But once I treat the cause, those band-aids then become nervous system retraining or immune system retraining. And those band-aids for me to start with are peptides. So I like to use BPC 157 to bring inflammation down in the whole system, TB4 frag to modulate the immune response. A lot of these patients have mast cell activation syndrome. So I'm using KPV and Amlexinox peptides, or anything that I think is needed for that person based on the testing and based on their history that tells me they need immune system balancing first. Before the advent of peptides, I wanted to do it, but it wasn't as easy. So I'm modulating their immune system first with peptides. Then it's kind of like pickup sticks, right? Because these patients have so many different infections in different areas of their body. And I also tell them it's like layers, different layers of a cake, right? So which one is at the top? Which one is at the bottom? Which one is screaming the loudest? Sometimes if I go for the infection that's making the most noise, it can actually, the patient isn't ready for that. So we have to, it's like pulling out very gently, very delicately, which one to go for first. So it really depends on the patient. You know, in naturopathic medicine, we're taught treat the gut first, right? Usually that's a good rule of thumb. Sometimes I am treating the sinuses first though, because I'm thinking about their brain. I'm thinking about their cognition. And I think about the gut-brain connection and the sinus-brain connection. And the sinuses are closer in proximity than the gut. Sometimes it makes more sense to come in and treat the sinuses after I've put in place the immune modulatory treatment with peptides.